Hello guys, welcome back to my channel. I am Shima Sobia Rahman and today I will be talking about a very interesting disorder that I learned in Masters in Clinical Psychology program, which is Obsessive-Compulsive Disorder. In this video, I will be taking you through what is obsession, what is compulsion, symptoms of obsession compulsion disorder. We'll also be looking at certain myths that accompany with the disorder, the causes of the disorder, and also we will be looking at the treatment that can be useful for this disorder. In the end, I will give you some tips and tricks that you can use to manage your OCD at home. So what is OCD? OCD refers to obsession compulsion disorder. This disorder has two parts. One is the obsession, the other is the compulsion. Obsession refers to intrusive and unwanted thought that can lead to significant distress or impairment in one's life. And compulsion refers to the actions that one does over and over again in order to suppress or ignore these thoughts. When we learn about OCD, we learn about various themes that accompany OCD. Few of them are the obsession of someone will harm them, the obsession with contamination, that there are germs everywhere. There is an obsession with forbidden thoughts or sexual thoughts, or they want to be perfect at everything at all times, which is also known as perfection. So when we talk about compulsion, we talk about the actions the person does in order to suppress those thoughts. So it can be regular washing of hands, it can be them checking their locks over and over again, it can be cleaning the entire house over and over again. Any thought that calms them down and does not help them get absorbed by the obsessive thoughts. Okay. Another thing to remember, compulsion is not equal to pleasure. So when you're talking about gambling and stuff, people do it over and over again because they're getting pleasure out of it. Compulsion does not give you pleasure. It just helps you to ignore the obsessive thoughts that are causing distress. So OCD is basically like a cycle. So in OCD, what basically happens is you have an obsession or persistent, recurrent, unwanted thoughts or images, which causes anxiety. Because of the anxiety, you do indulge in certain type of compulsion or action. Now, this action or compulsion gives you temporary relief until the obsession or the thought returns back. So it is a continuous cycle. For understanding the symptoms of OCD, I would like to use this. This is DSM-5 text revised version, which all the psychologists right now are using. And this has a lot of knowledge about all the disorders which are associated with mental health. It helps with accurate diagnosis and also treatment planning to a certain extent. Yes guys, there is a PDF version to this, but I generally like having hard copies because I like reading it out of a book, and especially it is useful to have it on your desk at all times when you practice. And I will be soon starting my practice from July onwards. Coming back to this OCD diagnostic criteria, according to the DSM states that obsession is the recurrent, persistent thoughts or urges in form of images which are unwanted and cause persistent distress to an individual. Okay, and in order to avoid these repetitive and unwanted thoughts or images, people indulge in certain actions over and over again, which is called the compulsion. Another thing is, this obsessive behavior and compulsions are very time consuming, which means it takes more than an hour every day. It is not explained by any medical or mental health conditions. People with OCD can have good or poor insight, where insight refers to the knowledge of the disorder within an individual, or it may occur with tic disorder. What is OCD also in DSM-5 is further divided into various type of disorders, which is body dysmorphia, hoarding disorder, skin picking, hair picking, and other related and unrelated disorders as well, which we will discuss as we go along in further podcasts. Now that we have understood symptoms, we can see that there are a lot of myths that are around, especially on social media. I see a lot of people claiming to have OCD, and where they are explaining that they are cleanliness freaks, that's why they think that they have OCD. OCD is much more than cleanliness. It is repetitive, unwanted, intrusive thoughts which will make them feel discomfort. And another thing, there is no particular age or background to OCD. It can be affected in all backgrounds and all the ages. Okay. And another misconception that is quite that we hear is, why don't people stop their behavior? It's a behavior, so they should be able to stop when they want to. OCD is a mental health condition, which means that they are conditioned in a way to behave in order to feel relaxed or feel less anxious. Therefore, they cannot stop the behavior whenever they want to. Okay, so there are various causes to OCD. One is genetics. So if your first line of blood has OCD, like if your parents have it, your siblings have it, you are more likely or at a higher risk of developing it. Stressful environmental situations can manifest into OCD very quickly. And other is your biological, where your brain structural changes are there, or certain issues with neurotransmitters are there, which can impact or lead to OCD in future. Over the years, OCD is known to cause significant distress and impairment can be in various areas such as relationship, work, academic performance, and so on. So before we move on to treatment and how to treat OCD and ways to manage OCD at home, let's look at some articles that show a very alarming rate of people who do not receive the required treatment. An article in 2023, which I will link in the description below for those who are interested, suggests that 1 in 50 children are having OCD symptoms at any given point of time. However, only a few of them receive the needed care and the evidence practice which can be effective for treating OCD symptoms. While an other article done during the pandemic years suggests that 38 to 98% of the individuals never seek out for help with regards to their OCD symptoms. The similar articles suggest that it takes 9 years to 17 years for people to approach the psychologist and ask for help. There are various reasons. One can be unawareness, poor insight. Another reason that I feel can be very prominent for people who do not seek help is the fear of being labeled or stigma or taboo attached with this mental health. Through this podcast, I would like to address the second point, which is the stigma and fear of labeling. I strongly feel that our mental health is more important than our physical health. Willpower does have more power than the actual strength in our body. Whenever we have a fever, we do approach the specialist, ask for help, ask for assistance, understand what's wrong with our body, and try to rectify the errors to be optimal functioning person again. So why don't we do the same when we are struggling not only with OCD but any kind of a mental health disorder? Whenever you feel that you are struggling and you're not able to cope with the stresses in your life, you should approach the specialist and ask for help. It is 2024 and mental health is growing importance, and people are becoming more aware about mental health. I've said this previously and I will say it again, that early intervention is the best chance of survival, and it helps us to immensely increase your quality of life. When we are talking about early interventions, let's quickly look at the treatment options available for OCD. Disclaimer guys, whatever I mention here is based on my knowledge from my bachelor's and my master's study. However, if you feel that you have symptoms of OCD, you should definitely approach a specialist and try to understand what is your needs and what exactly is your expectations, and how treatment can be tailored to meet your specific needs. As a psychologist, CBT or cognitive behavior therapy is widely given for OCD patients. In CBT, we tell them that our thoughts, feelings, and emotions are interlinked together, and these intrusive thoughts or the obsessions that people have lead to negative emotions and negative behavior. So we do a lot of activities like cognitive restructuring, behavior activation, and deep breathing techniques to help them relax and challenge their thoughts. But for that, exposure therapy is also given, where we do a graded exposure to fearful situations and help the clients encounter the situations and be okay with the uncomfortable experiences. In certain cases, certain difficult cases, certain medications are also prescribed. There are ways OCD can be managed at home. Again, this is purely based on theoretical reading. You need to approach your specialist to have a proper intervention plan in place. The first thing that can be done at home is having an open communication and showing empathy to the patient. This is a mental health condition, therefore certain challenges will be attached to this. So the family members or people near them should try and understand these challenges and not judge them. Give them the time and space to recover completely, because challenges will still be a part of the process even though they are in active therapy. Healthy distractions. Engage the client in certain kind of hobbies or activities that they like, which will enable them to be distracted from the intrusive thoughts. Like I said, in CBT, we engage the clients to do deep breathing. So any kind of mindfulness or relaxation activities can also be useful in OCD. Families play the most important role, because even if the client is in therapy, they meet the psychologist only for 45 minutes to 1 hour once a week. So behind the scenes, family needs to take the charge in helping the client overcome these difficulties. They should avoid all sort of triggers. They should avoid enabling behavior, which means if the client is crying for a chocolate, for example, and you give them the chocolate, that means you're enabling the given behavior. So in OCD, we particularly train the family not to enable their behaviors. Another thing that family can do is behavior monitoring or keeping a log of the behavior of the client, which makes it easier for psychologists to evaluate the progress of the client. In conclusion, I would say that I hope you learned something from this podcast. I have linked the articles. I have also linked certain resources in the description below for those who need and those who are interested in it. And before leaving, I would repeat the same thing. Your life is way too precious, guys. So don't waste struggling with something that is not worth it. If you have any feeling that you are struggling or any symptoms that you think are affecting your impairing your functionality, please ask for help. There is no shame in asking for help. It is 2024. Mental health is given equal and more priority nowadays. You are not alone. If you like this video, like always, like, share and subscribe. I will meet you soon with another interesting topic. Bye bye.